neoplasia. Okay, so what will be the coverage of this lecture? So we will define, classify, and have a nomenclature, important nomenclature of neoplasia. What are the characteristics of neoplastic lesions? The clinical significance or the effects of these neoplastic lesions, the epidemiology, predisposition, carcinogenesis, and diagnostic procedures for patients with neoplastic lesions or diseases. Okay, so what will be the definition? So in the book, we have neo means new, plasia means growth. So neoplasia is a new growth. But new growth can be a neoplasm or can be a tumor. Okay, so what is the difference between the two? Okay, so when you say neoplasia, it is more of a scientific term. Okay, but when you say tumor, it is a generic or a layman's term. So you will say, hala, may tumor hiya. Okay, or may bukol hiya, or may tumor, or may bukol hiya. So when you say tumor, this is a general or a generic or a layman's term. Okay, so as I have defined a while ago, neoplasia means new growth. Okay, but take note that not all new growth are neoplastic. Okay, so there are new growth that are not neoplastic. Examples are embryogenesis process, no? So during embryogenesis, kailangan lumaki yan or kailangan mag-develop yan para maging full-fledged na isang organ. So it is not a neoplastic. So in inflammation also, there is a tumor or there's a new growth. In a regeneration or reparation. That's why in the inflammation, we have the 5 cardinals of inflammation. And what are the cardinal signs of inflammation? One of which is the tumor. No? Then hyperplasia. So those organs or tissues undergoing hyperplasia, no? They have new growth. Lalaki ang organ na yan, pero hindi sila neoplastic. No? And for those organ with hormonal stimulation, lalaki din yan, but they are not neoplastic. So in other words, neoplasia or new growth is a general term. Okay? So what is other definition of neoplasia? So it means a proliferation and maturation of cells in normal adults. So as you can recall, we have 3 types of cells in our body. We have labile cells, meaning they proliferate throughout life, and the stable cells, which are limited proliferation of the type of cells, and the permanent cells are those who do not replicate. Okay, so what happens in neoplasia is that dumadami ito, no, nagre-replicate sila and uncontrolled regulation. So therefore, they form an abnormal mass or tissues. Okay, so therefore, the important definition of neoplasm is that it is a mass of tissue formed as a result of abnormal, excessive, uncoordinated, autonomous, and purposeless proliferation of cells even after cessation of stimulus which caused it. Okay, so it is not just new growth. Okay. So, what is neoplasm in our dialect? No, so sometimes you'll have to do your physical examination. You need to interview your patient. You have to ask your patients, or you also examine your patient. So, neoplasia is not barang. Okay, so diri barang ang neoplasia. Ha? A neoplasia is not also a tiaw. So, gintiawan diri ito neoplasia. So, neoplasia is not a sabrag. Okay? Neoplasia is not nabuyagan. Okay, so every year I ask the students to contribute terms from their locality, kung ano ang tawag nito, no? So, neoplasia is not also kulam. And neoplasia is not bati. Okay? Or, last time, oh my, bakit ayaw niya? Oo. Sandali ha, ayaw mag-move. What happened to you? Oo, bakit ayaw niya mag-move? Sandali ha, ayaw mag-move. For the next slide, what happened? Bakit ayaw niya? Sandali ha, baka naghang ito. Ayaw niya. Okay, how about that? Can you see now?
Hindi pa po, Doc.
Wala?
Wala pa po, Doc.
Dali, mag-re. How about that?
We can see your slides na po, Doc.
Okay. So again, as I have said, I filed some terminology. No, so for last year, I've got 3 additional words. Neoplasia is not nagabaan. Neoplasia is not nadarahugan. Neoplasia is not Nahilabia 1. Okay? So if you have something no in your locality, or if you have new terms aside from I mentioned, so you can send it to me. So I can put it in this slide. Okay? Or you may channel it to our chat or in our group message. Okay? So in neoplasia, the specialist is called an oncology. The science or the specialty is called oncology, while the specialist is called an oncologist. No? So the symbol of oncology or a cancer or a neoplasia is a crab. No, why crab? No, because if you look at no the characteristic gross picture of a crab of a neoplasia, para silang crab, no? Look at the edge, look at the periphery of the tumor. No, parang ganito sa crab, no? So because cancer is a Latin for crab, no? So that's why the symbol of oncology is crab-like. Okay? So what are the histologic components of a neoplasm or a tumor? So whatever will be the type of neoplasia, there are two histologic components. Number one is a parenchyma. Number two is a stroma. So when you say parenchyma, it is the proliferating neoplastic cells. So it determines the nature and evolution of the tumor. Whereas the stroma is where the tumor resides, no? Andyan ang connective tissue and blood vessels. So it provides framework on which the parenchymal tumor cells grow, no? So in this picture, so this is the parenchyma, this is the parenchyma, this is the parenchyma, and this is the stroma, no? The periphery are the stroma. So ito ang histologic components ng tumor. So another picture, no? So the tumor are the parenchyma, and the framework or the house in which the tumor is placed are the stroma. Okay, another picture. We have the parenchyma, then we have the stroma. Okay. So what are the classification of neoplasia based on behavior? So we have two, the benign and malignant neoplastic lesions. So I always associate benign with an angel looking. Then I associate malignant with a devil looking. So angel and a devil, no? Kasi ito or maganda, din ito pangit. No? So ang mga second year daw ay on the benign side, no? Hindi kayo hindi kayo itong devilish looking. Ano? Okay, so this is how will we differentiate benign and malignant. So look at the benign, no? Tumor here, well-behaved. No, well-behaved siya, maganda, then angel-looking. But if you look at the malignant, pangit na siya, no, pangit, and devil-looking. No, kasi nasisira na niya ang organ or tissue, then lumalaki, masyado din lumalabas na. Okay, so this is seen in your book, no, the Robbins. Okay, so this is an actual specimen where I got, no, so you can see here a normal mucosa here, as well as here. But if you look at on the right side, you can see the neoplastic. This is the tumor, no? So this is the angel part, and this is the devil looking. So this is the malignant component. So the transition from normal to malignant. Okay, so neoplasia also is classified based on the type of tissue origin. Kanina behavior yon. Ngayon, where did they come from? Okay, they come from epithelial, mesenchymal, mixed, or more than one germ cell layer. So pag epithelial, they are derived from tissues or organ covered by an epithelium. So any organ o any tissues na mayroong epithelium. Whereas mesenchymal, they're derived from soft tissues, no? Any type of connective tissue. Okay? So let's go to the nomenclature. So how do we name, no? Neoplasm. So pag epithelial in origin, it can be benign or it can be malignant. So pag benign, what are the terminologies? Papilloma, adenoma, no? So always ends in oma. pag benign epithelial. Okay? But there are exceptions, no? Mayroon ding polyp, mayroong cyst, and mayroong cyst adenoma. Okay. But kung malignant naman, ang counterpart, ang tawag niyan ay carcinoma. So always may ending na carcinoma. So squamous cell carcinoma, adenocarcinoma, and transitional cell carcinoma. Okay. So what is papilloma? So papilloma is a benign epithelial kasi nag-ends in oma. So grossly, para silang mga cauliflower-like lesions. No? Para silang mga cauliflower-like lesions. Yan. So makikita ninyo. No? Parang cauliflower. So papillomas are finger-like projections of a tumor. Okay? Whereas polyps are any pedunculated structure from the epithelial lining. So, yan ang polyp. No? This is the normal mucosa. Then, mayroong polypoid lesion here. So, it's a form of a benign tumor. So, polyp yan. Polyp. Then, this is the normal colon. So, this is the polyp. Then, you have the core, a fibrobascular core. Okay. So, this is a cyst. No, a cyst is a space occupying mass lesion that is benign. Okay, so this is a cyst. So ang requirement ng true cyst, kailangan siyang ma-epithelial lining. So in this type, the epithelial lining is a stratified squamous epithelium, and the cyst is filled with numerous keratin flakes. Okay. So the contents of the cyst depends upon the lining. No? So kung ang lining is stratified squamous epithelium, then expect the contents of the cyst are filled with keratin materials. No? So this is a cyst adenoma. So this is a tumor with multiple cystic structures. So hindi lang isa, 1, 2, 3, 4, and so on. So it's called a cyst adenoma kasi glandular ang kanyang formation. So yan. So you can see one glandular, one glandular, one glandular. Kaya tinawag siyang cyst adenoma. Okay? So let's summarize. So if it is an epithelial tissue, it depends kung saan sila na-derive na type of epithelium. So for example, epidermal squamous cell, ang benign tumor niyan is squamous cell papilloma or epidermal inclusion cyst. So if it's from liver, we call it hepatic adenoma. Okay? So benign tumors usually designated by adding oma to the cell type. No? For example, adenoma. Oma. Adeno means gland. So benign tumor arising from glandular structures. With lyo, myoma, oma, so benign. So this is a benign tumor arising from smooth muscle cells. Okay? But there are exceptions, no? In that rule. So there are tumors ending in oma, but they are malignant. So examples, lymphoma, hepatoma, mesothelioma, melanoma, and seminoma. So they ends in oma, but they are malignant. So there are exceptions to the rule. So this is a thyroid mass. So you can see a thyroid tumor. Maganda ang margins. Okay siya. Benign looking. So what will be the terminology here? So under the microscope, you can see here the thyroid. This is the tumor, and this is the normal thyroid tissue. Okay? So this is called follicular adenoma or a thyroid adenoma. So paano natin ma-differentiate ang adenoma here from a normal thyroid tissue here? Okay, so this is the adenoma. You can see mas malalaki ang mga nuclei nila compared to the normal thyroid. So this is a follicular adenoma. How about this one? No? There is a tumor made up of a lot of blood vessels here. So small and large type of blood vessels. So it's called hemangioma. Okay, how about malignant? So those are for benign. How about for malignant? As I have said, kung malignant, they end in carcinoma. Okay. So carcinomas, they arise in epithelial tissues. So squamous cell carcinoma. Ibig sabihin, malignant tumor, epithelial and derivative derived from squamous cell. So adenocarcinoma. Carcinoma means malignant epithelial tumor derived from glands. Adenocarcinoma. Okay, so this is an example of squamous cell carcinoma. So this is a normal squamous epithelial lining, stratified squamous epithelial lining. But if you look at the squamous cell carcinoma, devil na, no, pangit na. So look at the lining cells, no? They invade, they go down, nagkanya-kanya na sila. No, nagkanya-kanya na. Then ang clue natin is the presence of mga keratin pearls here. Okay? Then closer view of that. So nasisira na, no? Ang normal lining epithelium because squamous cell carcinoma na to. They go deep inside. Then pangit ang mga cells. Okay? Then as I have said, this is a normal mucosa of a colon. Normal, but in the right side you can see pangit mga glands. So this is an adenocarcinoma. Okay? So look at the glands, no? Kanya-kanya na sila. Pangit, no? They go inside, they go deeper and they infiltrate the stroma. So this is adenocarcinoma. Closer view, no? Look at the normal mucosal glands here, but this is the malignant glands here, no? So they invade the innervate structure, then mayroong mga mitosis, abnormal mitosis. Okay? Then another malignant tumor, okay, is called the mesenchymal. So dito na tayo. Kanina epithelial yun, ha? So look at that. So epithelial. So let's go now to the mesenchymal. Okay. So mesenchymal, meron ding benign and malignant. For benign, it ends also in oma. Okay. And in malignant, they end all in sarcoma. Okay. Kanina, carcinoma. Take note, ha? O parehas sa mesenchymal. Ang pagkakaiba lang, if it is malignant kasi it ends in carcinoma, whereas pag mesenchymal, they ends in sarcoma. Okay? So for example, wow, no, this is a uterus. Then you can see mga tumor. Okay? So maganda, no? They are well defined, magandang itsura, marami nga lang, no? So this is under the microscope, you can see a smooth muscle cells. So this is a leiomyoma. So this is a leiomyoma, meaning benign mesenchymal tumor derived from smooth muscle. And again, another tumor, a thymus. You can see here a yellow, well-defined tumor made up of fats. So under the microscope, you can see a benign adipocytes or lipocytes or adipose tissue. So this is a lipoma. Okay? Whereas kung malignant naman, the ends in sarcomas in compared to your carcinoma. Okay? So this is a muscle in the uterus. No? Kanina, pinakita sa inyong leiomyoma. But now, look at the tumor. No? Pangit. No? May kanya-kanya silang hitsura. Then they tend to infiltrate the nervine structures. So when we look at the microscopic findings, you can see fats, no? Then malalaki na ang mga cells dito. So this is an equivalent of a liposarcoma. Lipoma yon, benign fatty tumor, ngayon naman malignant fatty tumor. So look at that, no? Iba ng mga lining cells nila compared kanina. Look at the yan, no? So maganda pa, normal ang fats. But if you look at here, so pangit na ang mga cells. So this is a liposarcoma. Okay? Next is a uterus, no? Then a uterus, you can see maraming masses, iba-iba, iba-ibang sizes, hindi na maganda ang margins, may mga necrosis. So this is look at the cells, no? Compared sa leiomyoma kanina. So this is the counterpart malignant or sarcoma. So this is a leiomyosarcoma. Okay? So compare the benign leiomyoma, compare that to your leiomyosarcoma. No, look at the cells. Pangit na, then there are a lot of abnormal mitosis here. Okay. Then in the bone, no, there is a tumor. This is a bone, and you can see there is a tumor here. Then microscopic pictures show malalaki ang mga chondrocytes, no? Kanya-kanyang shape, pangit ang mga cells. Iba-iba ang itsura ng chondrocytes. So this is a chondrosarcoma. Okay. So let's summarize, no? Epithelial-derived tumor, kung benign, they ends in oma. Pag mesenchymal, they ends also in oma. Nagkakaiba lang yan sa malignant. Kasi kung epithelial, they end in carcinoma, whereas in mesenchymal, they end in sarcoma. Okay. But there are also mixed tumors. So when you say mixed tumors, they have divergent differentiation. So for example, pleomorphic adenoma. So they have glands plus fibromyxoid stroma. So Fibro Adenoma. So we have glands and fibrous tissue. So dalawa ang component. But you should not be confused with teratomas, no? In which the tumors are derived from 3 germ cell layers. An example of mixed tumors is, this is a pleomorphic adenoma. So may glands ka, then may mga cartilage. So this is a pleomorphic adenoma, a tumor of the salivary glands. Okay, so as you can see here, yan ang tumor niya. So this is a pleomorphic adenoma, which is a form of a mixed tumor. Another is a breast tumor, which you have the ducts or the glandular structures plus this fibrous tissue. So dalawa ang component. Dalawa silang lumalaki, dalawa silang dumadami. So this is called a fibroadenoma. No? So yan ang gross. Maganda kasi benign. So this is a fibroadenoma. And to confuse you more, okay, we have confusing terms. No? That malignant tumors that sound benign. So as I have said, I've already mentioned this one, that these are tumors that end in oma, but they are malignant. So such as lymphoma, mesothelioma, melanoma, and seminoma. There are also non-tumors, but sound like tumors. No? For example, hamartoma. So hamartoma is just a mass of disorganized indigenous tissue. So for example, in the lung, kung baga excess lang siya in that organ, that the form a mass-like lesion. Then a choriostoma. So these are heterotropic or ectopic benign or normal tissues na napunta sa ibang lugar, no? And there are also names that seem to come out nowhere, no? These are exceptions, no? These are tumor, but they don't follow the name of oma and carcinoma and sarcoma. Just like the nevus, no? Nevus is a tumor in the skin made up of nevi. So mga usually seen in the skin. Then leukemia. Leukemia is also a tumor or a cancer in the blood. No? Then hydatidiform mole. So these are in the placenta, no, or in the tumor formations in the placenta. Okay. Then let's go to the tumor characteristics. Okay. So what are the tumor characteristics? Number one is tumor. Masasabi natin na cancer yan. Compared to normal, so these are normal cells, these are cancerous cells. Usually, malalaki ang nuclei and they have variably shape and they are darkly stained. So they are hyperchromatic. Another is they have, look at the normal cells here, cancer cells, very active yan in reproduction. Therefore, they have many dividing cells. You can see lots of mitosis. And also, disorganized ang arrangement ng mga may malaki, may maliit. So, disorganized means they are dysplastic. Then we have also pleomorphic. So, this is a normal cell. This is the cancer cells. So, look at the cells. Iba-iba ang mga shape. No? So, that's why mayroon ang mga cancer cells, neoplastic cells, mayroong pleomorphism. No? Then we have also architectural anarchy, meaning nawawala na ang normal feature. So look at this, no? Kita pa ang cytoplasm mo, kita ang nucleus mo, kita ang mga nucleoli mo. But kung cancerous cells na yan, they lost a normal feature. So we call it architectural anarchy. So nawawala na, hindi mo na ma-identify kung saan ang nucleus, saan ang cytoplasm. Okay? So these are the characteristics of neoplasia. Number one is anaplasia. So we have also the term differentiation, in which it means extent to which the neoplastic cells resemble normal cells both morphologically and functionally. So kung ang cells ba yan or ang mga tumors na yan, makikita mong pa, malalaman pa kung they resemble to that organ or tissue. No? But kung wala na yung differentiation, so hindi mo na yan ma-identify, it's called anaplasia, or a poorly differentiated tumor. Okay? And anaplasia is the hallmark of malignant transformation. Okay? Then differentiation is how much the tumor cells resemble their cells of origin. So we have well-differentiated, moderately differentiated, and poorly differentiated. Pag well, ma-identify mo pa. For example, galing siya sa squamous cells, galing siya sa glands. Moderately 50-50, no? 50% identify, 50% hindi mo na ma-identify. Pag poorly differentiated, hindi mo na talaga ma-identify. So it's equivalent to your anaplasia. So benign tumors are usually well differentiated, and poorly differentiated tumors are malignant usually. Okay? So you can see here, no? A well-differentiated tumor. Kasi ma-identify mo pa kung anong organ siya. So this is from thyroid gland. So this is a thyroid adenoma. So this is a well-differentiated. Another is this tumor. No? So you can still identify na squamous siya. So kasi kahit tsura niya normal squamous lining here. Okay? So these are your squamous epithelial lining. Okay? Then ito, ma-identify mo pa ng mga glands because makikita mo, makukompare mo dito sa glandular structures. So these are well-differentiated adenocarcinoma. But how will you know if cells or tissues are anaplastic? So the characteristics of malignant cells will show hyperchromatism. So very dark ang kanilang nuclei because they have abundant, rich DNA and RNA. Then they have irregular nuclear membrane. So tingnan ninyo, no? Iba-iba ang shape ng nuclear membrane compared sa iba din. Pangit, no? Then high-NC ratio, meaning high nuclear to cytoplasmic ratio. The normal is 1:4 or 1:6. No? Pero pag neoplasia yan or tumor na diderange na. Then pleomorphism, meaning variable sizes and shape. Then you can see also abnormal mitosis and loss of polarity. So ito ang normal polarity, but in the tumor, wala na, kanya-kanya na sila. Okay? Then you can see tumor giant cells. No? As a form, kasi mabilis sila mag-reproduce, mabilis kumain, mabilis lumaki. So ganyan sila kalalaki ang mga tumor or cancer cells. Another characteristic of neoplasia is the rate of growth. No? Siyempre, pag the growth of tumor correlates with level of differentiation. Pag well-differentiated, they're slow in growth. No? Pag poorly differentiated, mabilis yan. Okay? Another is local invasion. So local invasion is the second most reliable feature that differentiates malignant from benign tumors. And 4 is metastasis. Metastasis is the most reliable feature of a malignant tumor. So kahit pa yan benign looking, kahit angel looking, pero kung nag-metastasize na yan, it is already a malignant. So metastasis means the spread of the tumor to other parts because of the penetration into blood vessels, lymphatics, and body cavities. Okay, so for metastasis, we have 3 ways. Pwede siyang direct seeding, pwede siyang lymphatic spread, pwede siyang hematogenous spread. So direct seeding meaning involvement of the peritoneal cavity. So malapit lang. Surface of abdominal viscera, so the drops. Example is your breast, your tumor in the ovary and then the stomach called the Crockenberg tumor. No? Then for lymphatic spread, usually for carcinomas. Then sentinel lymph node, no? Then for hematogenous, usually sarcomas. Okay? So this is a direct seeding, no, sa liver tumor. So malapit lang ang tumor, so kaya nag-direct seeding lang siya. Then this is a lymphatic. So this is a lymphatic tissue. So you can see the tumor inside the lymph vessels. And this is a lymph node metastasis also. So this is the normal lymph node here, but you can see the glands here, the adenocarcinoma that invades the lymph node. Okay, another picture. And this is sarcoma, no, that goes into the lung. Okay, so we have also the concept of carcinoma in situ. So what is carcinoma in situ? So carcinoma in situ means that the tumor is only confined in the epithelium. Hindi pa sila nakakross ng basement membrane. So this is the basement membrane. Once nakakross na yan, they're already called invasive carcinoma. Pero pag nandyan pa lang sa lining, they're called carcinoma in situ. Okay? Pag nakakross na yan sa basement membrane, isa lang, is already an invasive carcinoma. So what are the clinical significance of neoplasia? Okay, so number one, because they're enlarging tumor, they are fastly dividing, they can cause local pressure on the adjacent structure. Okay, so some of these tumors release also hormone or hormone-like substances which can cover up, no, sa other lesions. Then they can cause bleeding and infections kasi naiipit ang mga blood vessels. They can cause rupture and hemorrhage. Then the symptoms result from rupture or infarction. And they can also cause cachexia or wasting. And of course, the death. No? So we have also what we call a cancer grading. So this is also known as a tumor grading. So when you say grade, how the cells or the tumor resembles the original cells, no? For example, squamous cells, no? So ito is low grade kung baga nag-resemble pa siya. Moderate kung 50-50, then high grade kung hindi mo na siya ma-identify. Okay? So for example, this is a breast tumor. So you can still identify the ducts, no? So this is a breast carcinoma low grade. But in here, hindi mo na ma-identify kung breast yan, no? So this is a breast carcinoma high grade. Okay? As also in the prostatic glands, no? As you go higher, tumataas ang grade niya. So ito ang okay pa, mga itsura ng glands. Then later on, pumapangit ng mga glands. Some are solid already. So they are called poorly or high grade. Okay? So this is in the breast, no? Grade 1, grade 2, and grade 3. So you can still identify the glands here. Ito, medyo may solid portion na. Lahat solid na. Okay? Then how about staging? Grading is different from staging. So when you say staging, it tells you how far the tumor spread. So you can have pathologic staging or we have a clinical staging. At present, we use the TNM system. We have the tumor, the lymph node, and metastasis system. So this is a very useful procedure, no? To know the stage of the tumor. So this is what I mean by TNM, no? For staging of the tumor. So it includes the tumor size, involvement of the lymph node, and the presence or absence of metastasis. Okay? So for example, esophageal cancer, no? So for staging, titingnan natin kung gaano siya kalalim. So tumor, gaano kalalim. Umabot pa siya hanggang kung anong layers, no? Then you have to check also the lymph nodes and the metastasis. Huh? Then cancer epidemiology. So this is taken from Cancer Statistics 2021. So for the male, still the number one tumor or cancer is prostate, followed by the lung and bronchus and colon and rectum. Whereas for the female, the most common is the breast, followed same as the male, lung and bronchus, colon and rectum, no? But for the death, no? Ang sa males, the most common cause of death is for the lung and bronchus, same as that with the female. So this is a 2021 statistics. Okay, let's go to the carcinogenesis, how the cancer developed, no? So, or what causes neoplasia? So the pivot, the core, bakit nagkakaroon ng cancer is because there is a genetic damage, no? But this genetic damage is non-lethal kasi ang nangyayari lang sa kanila is dumadami lang sila. So this is the core, non-lethal genetic damage. So hindi siya barang, hindi siya kung ano man. So genetic ang problem. So oncogenesis, a tumor is formed by the clonal expansion of a single precursor cell that has incurred damage. So nagsimula yan sa isang cell lang na nag-mutate, so dadami ng dadami. So it's called a monoclonal oncogenesis. And take note, this is a multi-step process, both phenotypic and genetic level. So there will be accumulation of multiple mutations. And because of that, no, it will progress. Okay, so this is found in your book, no? So normal cell, pagka nagka-DNA damage yan, it will cause a failure of DNA repair. Kung hindi na siya ma-repair, it will undergo to these three processes. So ito na ang magiging cause bakit magkaroon ka ng cancer. So may explanation, no? Under molecular level. Okay. So the concept of proto-oncogenes. So oncogenes are genes that promote autonomous cell growth in cancer cells. But the unmutated or the normal cellular counterparts are called proto-oncogenes. Okay? So this is the normal cell. So normally, mayroon tayong mga oncogenes, may mga proto-oncogenes. So in the normal cell, you have the cytoplasm and the nucleus, may mga growth factors yan. So paano nangyayari kung mayroon ng cancer? So kung may neoplastic malignant cells na, either number one, dadami na ang growth factors mo. Number two, dumadami ang growth factor receptors mo. Kaya mas dadami at bibilis ang reproduction. Then nag-increase ang signal transduction. Then there will be an increase in the activation of transcription. So proto-oncogen, bago yan mag-cancer, maraming factors, no? Heredity, kung may cancers kasi na namamana. Mayroong exposure to environmental hazards just like radiation and chemical. Okay? So this is our example of proto-oncogenes. So you can see ABL, HER2, MYC, RAS, mga examples yan. So pag mag-mutate ito, magiging oncogenes na sila. So nagiging cancer. And we have also tumor suppressor genes. So these are nagsusuppress, no? Hindi sila maging tumor. So they are brakes to cell proliferation. Pero pag masira na itong tumor suppressor genes, ito na nangyayari, no? Wala nang brake ang sasakyan mo. So mababangga ka na. So ganyan din ang nangyayari sa tumor. So sa mga cells, kung wala tayong tumor suppressor genes, hindi mo na yan mapipigilan. Dadami ng dadami at lalaking-lalaki sila. Okay? So example of tumor suppressor genes are the RB, the P53, the BRCA1, BRCA2, and so on. But the most important, P53. Okay? Then we have also the two-hit hypothesis or the Nodson hypothesis for oncogenesis. Ano naman ang ibig sabihin nito? No, so this explains tumor, no, na una, hindi lang naman isang genes lang nagkaroon ng lethal damage, magkaka-cancer ka agad. So this theory believes that kailangan may double hit or may second hit para masira ang genes na yan para siya maging tumor. So that's why this explains na hindi lahat sa family nagkakaroon ng tumor. So for example, isang genes lang ang namana mo. So isang hit lang yan. So hindi ka magkaka-cancer. Pero you're lucky kung talagang dalawang genes ang mangyari sa'yo, magiging cancer talaga yan. Okay? So gaya nito, no? So to normal genes. So, isang damaged gene lang yan. Pero pag nagka-2 damage na yan, magiging tumor talaga yan. Okay. So pero dito normal siyang mag-start. Mayroon ding hereditary, no? So from the very start, mayroon na talagang ang damaged gene, inakatagpo siya ng another damaged gene, magiging tumor talaga yan. Okay? So I mentioned a while ago of the tumor suppressor genes, specifically your P53, because this is considered as the guardian or the gatekeeper of the genome. So this is a molecular policeman. So in other words, pag masira ang P53 mo, talagang magkakaroon yan ng lethal damage, non-lethal damage or mutation ang mga genes which can cause tumor. Okay? So for example, may DNA damage, may cell cycle abnormalities, hypoxia. So ang P53 mo, which is the guardian or the police of the cells, it can go to two ways, no? Number one, it can cause cell arrest. DNA repair, okay, naging cell cycle restart. Pero ang problem here, kung may apoptosis ka, then normal death and elimination of the damage, which is normal. So pag ang ito maging abnormal na, it can cause cellular and genetic stability. So yan ang role ng P53 mo. Okay. Then we have also a multi-step carcinogenesis. So ang cancer, hindi naman ibig sabihin na once na magkaroon ka ngayon ng exposure sa araw, magkakaroon ka kagad ng skin cancer. No. So mayroon din yang multi-step, mayroon yang spectrum. No. It starts from normal, dysplastic, adenoma, and carcinoma sequence. Okay? So, nag-start muna siya sa normal, naging hyperplasia, nag-dysplasia, carcinoma in situ, din nag-cancer. So, you're lucky kung dito pa lang na-detect ka na. No? Kasi hindi na yan magiging invasive cancer. So, hindi naman lahat ng cancer na isang exposure mo lang, cancer ka kaagad. So, mayroon silang dinadaanan, may spectrum yan. Okay, so this can be different possible events. No, it can be benign to benign, benign to dysplasia, and so on. So that's the cancer spectrum. And what are the causes of cancer? So there are environmental or carcinogens, so which are proven. No, my chemicals, microorganisms, and radiation, and hereditary or genetic defects. For chemical, no, mayroon talaga, no? So hindi naman ibig sabihin ma-expose ka ngayon, magka-cancer ka kaagad. So may initiation na yan, may promotion, then further DNA damage din magiging cancer. So for example, benzene, no? Benzene is really carcinogen. Alcohol and smoking. So hindi naman ibig sabihin uminom ka lang ngayon ng tequila, bukas may cancer ka na. Nag-smoke ka lang ngayon ng isa, magkaka-cancer ka na. No. So kaya yan ang explanation. May initiation muna, may promotion, then further DNA damage, then magiging cancer. Okay. So there are direct acting and indirect acting chemical carcinogens. No? So mayroon ding mga microorganisms. Ang proven na nakaka-cancer ay mga viruses. An example of the viruses are your adenovirus, no? The HPV, no, which can cause cervical cancer. The Epstein-Barr virus, which can cause the nasopharyngeal, Burkitt's, and Hodgkin's lymphoma. No, mga hepatitis virus, which can cause the hepatocellular carcinoma, and the leukemia virus and hepatitis C virus. So mga viruses, maraming nakaka-cause ng cancer. But mayroon ding bacteria. No, ang proven is your Helicobacter pylori, which can cause a mild lymphoma and adenocarcinoma in the stomach. Okay, so that's why pag mayroong gastric ulcer, kailangan i-treat yan, baka H. pylori ang cause, kasi later on makaka-cause yan ng cancer. Okay, then may radiation carcinogenesis. So exposure to UV rays. So nagkakaroon na ng cancer if you UVB, no? Exposure to 280 to 320 nm wavelength, which can induce cutaneous carcinoma. Radiation, no? Carcinogenic ang mga may A particles, B particles, protons, and neutrons. Pero hindi, sabi ko kanina, hindi naman isang exposure mo lang, cancer ka kaagad. This is after 7 to 10 years pa yan. So magkaka-leukemia ka or any other solid tumors. Okay. So are cancers inherited? Yes. No? Because we have autosomal dominant cancer, familial cancers, and autosomal recessive cancers. For autosomal dominant, please remember, very rich, cute, and nice men hereditarily like familial females. So these are all hereditary cancers. Whereas familial cancers, it's very true, no? Pag mayroon sa family, pag may history sa family ninyo ng colon cancer, breast cancer, ovarian cancer, and pancreas, please check every year. Kasi proven talaga yan na it runs in the family. No? Kasi isa lang ang genes ninyo. Then for autosomal recessive cancer, remember big facts. Okay? These are all hereditary cancer in autosomal recessive form. Okay? So how do we diagnose in the laboratory? So of course, histopath. No? We do histopath and cytopathologic evaluation. We can do flow cytometry for lymphomas. We can do immunohistochemistry and DNA probe analysis, the polymerase chain reaction. Okay, so this is a flow cytometry. Okay, this is immunohistochemistry. So this is the normal tissue, or this is the H&E, but if you do immunohistochemistry, you can prove na talagang sa skin or epithelial in origin ang cancer. Okay, so these are immunophenotyping. And interventions, how do we do kung may cancer ang patient? So of course, surgical interventions, radiation therapy, chemo, gene therapy, stem cell and bone marrow transplants, and immunotherapy. No? And latest interventions, mayroon na cryotherapy. So they freeze the tumor. So para mamatay daw ang tumor. So pinifreeze mo na yan to the negative degrees. No? Pag freeze na yan, they believe that the tumor is dead. Then i-remove na nila yan. So that's called a cryotherapy. Another is immunotherapy. So they inject, no? They boost mga immunoreactive agents, no, para mamatay ang cancer. So it's called immunotherapy. Then we can have also microwave ablation. No, ina-ablate nila. So ablating cancer via heat from microwave. So namamatay daw ang cancer, but they can wala pa nito sa atin dito, no? Then how about preventions? Okay? So lifestyle choices, of course, no? Number 1. Number 2 is you must have to undergo screening tests, just like pap smear, no, fecal test, no, pag-check yan. So cervical pap smear is the most successful screening tests, no? So treatment of infection. So remember, mayroong mga infectious agents na nakaka-cause ng cancer. So syempre, kung hindi mo i-treat ang H. pylori, ang hepatitis mo, talagang one of the complications will develop into cancer. Then of course, the power of vaccination for HPV and hepatitis. No? And of course, kung talagang ma-indication for surgery, you need to do surgical management, especially for breast and ovarian tumors. Okay? So I think I'm gonna end my lecture there. Any questions? Any questions? So for the details, you can use your Robins for the details. Any questions? Mr. Reda? Wala na?
Wala na po ata, Doc.
Wala, so it's very clear, no? So please read your book for the details. No questions? Okay, if none, Ms. Rueda, can you take the attendance, please? So there are 117.
Okay po, Doc. Guys, mapa-open cam na lang.
Please open all your cam if you are present.
Okay, ma-take na po ako screenshot. 1, 2, 3.
Okay. Thank you, John. Please submit the attendance to me once you are okay with your time. Okay? So thank you very much, guys. Continue to be safe. And let's pray na mag-face-to-face na tayo. Limited face-to-face soon, no? if this will continue na maganda na ang ating statistics, no? So please do also your part. Please help your community to encourage everyone to have vaccination, and also encourage your community, your family to follow the health protocols always, and always avoid the overcrowding, no? So always, we all also to do our part. Kasi kung hindi rin tayo tutulong, kahit anong vaccination, kung wala din tayong self-discipline, wala tayong contribution, so wala din mangyayari. So all of us will suffer. Okay? So let's do our part kahit in a small ways. Okay? So thank you very much, guys. Hope to see you soon. So I miss all of you. Bye-bye.
Thank you, Doc.